Welcome to the Continuing Education module, Selecting Targets for Your Wellness Program, choosing carefully your areas of focus. The agenda for this module includes key definitions, program goals, the Big Eight, and then for each of the Big Eight, recommended prevention targets and typical interventions. Some additional targeting opportunities, and a summary of key points. Our definitions for each of the major issues of wellness as well as a wellness program is as follows. We define wellness and use the term in the following way: an intentional choice of a lifestyle characterized by personal responsibility, moderation, and maximum personal enhancement of physical, mental, and financial health. So that's our orientation to start with. When we talk about worksite wellness programs and corporate wellness programs, we're talking about organized programs in the worksite or serving worksite populations that are intended to assist employees and their family members in making voluntary behavior changes. So our focus in wellness is on behavior change, which reduce their health and injury risks, improve their health consumer skills, and enhance their personal and family wellness, individual productivity, and well-being. Additional definitions that are useful for us, first of all, is health risk, a clinical measurement or state or a health-related behavior that conveys an increased level of risk for chronic disease and development of chronic diseases, acute disease, healthcare utilization, injury, disability, and/or premature mortality to those who are at risk. Behavioral targets include a specific behavior or behavioral pattern that conveys an increased level of risk for chronic disease, acute disease, healthcare utilization, injury, disability, and/or premature mortality to those who are at risk. By the way, the definition of premature mortality is dying before the average life expectancy for the cohort in the population that you are a part of. That includes a gender and age characteristic. So premature mortality is essentially can be converted into life years lost when we look at what age and what point in life an individual expires and how that relates to their specific age and gender cohort and their expected life or life expectancy or length. In the context of prevention target, we're dealing with a health risk or behavioral target that is the programming focus of a worksite wellness program. So when we use the term prevention targets, we really are talking about either health risk or behavioral targets and behavioral risk factors and clinical risk factors that are the focus of much of our wellness concern. Now, typical goals of wellness programs include improving employee health, reducing the growth of health costs, future health cost, oftentimes what's called medical trend with a given population, reducing health risk, their prevalence and severity, saving money for the employer, and that's where we can talk about health plan costs, sick leave absenteeism, workers' compensation costs, disability insurance costs, short-term and long-term, and presenteeism-related cost. Enhance employee productivity, so by whatever measurement metric or approach we want to use. Satisfying employee needs, so dealing with the expectations of employees around wellness. Improving the recruitment and retention of employees, and changing the organizational culture or creating more of a wellness-oriented culture. So these are very typical goals for worksite wellness programs. Given the range of goals that wellness programs oftentimes have, we think about the Big Eight as being a starting point for our prevention targets for these programs. First of all, one of the major ones we want to focus on in virtually all wellness programs is increasing the level of activity of our populations. So that physical activity, the move issue. Secondly, we want to continue to work with the approximately 20% of American employees that are using tobacco on a regular basis, either in a smokable form, a vaping form, or other chewable and or smokeless tobacco versions. In addition, stress management would be another area where we're looking at the chronic excess stress and being able to work on strategies to help the individual deal with that stress over time. Another one of the prevention targets is heart health, which includes both our ability to look at blood pressure amongst the population that we're working with and the fractionation of cholesterol and blood lipids. So those are the two major issues in heart health. Weight management refers back to the problem that's occurring with about 2/3 of our employee population in the US being either overweight or obese. So it's dealing with that issue. Nutrition deals with the issue of the pattern of food consumption and our use of food for a variety of different reasons, and emotional as well as physical. And then medical self-care includes the ability for us to be looking at a series of behaviors and skills around dealing with the very high frequency personal symptoms and medical symptoms that we generally are encountering. So according to the National Health Survey, the average American over the age of 18 experiences somewhere around 2 per month average medical symptom events on a personal level. So the ability for us to be looking at 24 times a year, we are making choices about whether we seek medical attention, whether we ignore it, whether we do home treatment, whether we do use home diagnostics, whether we visit the WebMD.com website. So all of those choices and skills around interpretation of symptoms. And then finally, back care, where we're looking at the issue that affects about 75% of working Americans within a 2-year period will experience some sort of back pain event. So we're looking at what are the ways in which we help reduce the severity and the frequency of that particular problem. So these are our big 8. They are a major starting point. We advocate in the WellCert program that people generally think about putting these together. The first 6 tend to be oriented toward the metabolic syndrome and longer-term chronic disease prevention. The last 2 tend to have shorter time periods in terms of having effect on medical claims and or sick leave and or the other economic variables that we're looking at in wellness. So these are what we would generally start with. We're going to take each of these in turn and dig a little deeper into the behaviors, the risk issues that are involved, and the interventions that are typical of each of these. Let's start with physical activity. And if we look at the behavioral targets, we're looking at physical activity from the sense of aerobic conditioning, and that's our cardiopulmonary function. We're looking at it from a stretching and flexibility base. We're looking at a strength or resistance training base. So those are the 3 major things that we generally look at under physical activity. The health risk issues relate back to a sedentary lifestyle, the lack of muscular conditioning, the inflexibility that we have when we're not able to stretch and be very flexible, and how those add up to the metabolic syndrome, which puts our inactivity along with issues that have to do with heart health and weight management, nutrition, and then together are seen as metabolic syndrome. So those are the major health-related health issues. The typical interventions for this particular area are going to include health risk assessments or well-being assessments, which are asking people about the level of physical activity that they're generally engaged in. There may be an on-site fitness facility. We may be providing a corporate discount for an external fitness facility. We may have a walking program that is advocating group activities around walking during the workday, aerobic activity and aerobic training, the yoga activity, flex time for exercise, sports and recreation league options, online trackers, and finally wearables. So these are some of the typical interventions that we tend to look at in addressing these particular behavioral targets and these specific health risk issues. In addition, there's the issue of YouTube videos. So our ability to build into our program access to those YouTube videos that have to do with inspiration or motivation around physical activity, as well as some of the skill-based kinds of things of how do you do some of these types of physical activities. So the typical interventions, again, are listed on the right. Tobacco use is our next area. The behavioral targets that we're focused on are the smoking behavior, cigarettes and pipe uses, and smokeless tobacco. I probably would add vaping as another one of those, using a vapor or e-cigarette type of tobacco or nicotine product use. The health risks are going to be smoking related. About 20% of our working population are generally smokers. They were changing in terms of who within those populations, but those are usually pretty typical numbers from most survey work that's been done. And then we have nicotine addiction as another portion coming out of some of the newer types of tobacco, e-cigarette and vaping modes. The typical interventions can include the asking of questions about these particular risk factors and behavioral targets. It can also include our smoke-free or clean air acts and how those interact with our work setting. We have smoking cessation. So we have the issue around how people are learning how to change their patterns and habits and around smoking activity. We have general education about the risk involved and the activity. We have coaching as a way of being able to intervene and help people around that. We have nicotine replacement therapy, and that's where our over-the-counter as well as prescription medications that have to do with nicotine replacement are another portion and way in which our interventions are established. We do have the e-cigarette and vaping as ways that now people are shifting their approach to this area of tobacco use by being able to look at different approaches. The online modules, so those may be part of an LMS, of a learning management system, or they may be just simply online modules that are provided on this topic area and or the skills for making changes in this behavior. And YouTube videos are another possibility for interventions that we can use in a program that are designed to help the long-term smoker. One of the individuals that over the years has developed some materials for the smoker who chooses to continue smoking, but can in fact work on becoming as healthy as possible to reduce the adverse sequelae and the adverse consequences of smoking behavior long term. So that's the issue, Smoker's Book of Health. Ferguson, as the author, was one of the resources that was used with that particular strategy, which could potentially be a useful strategy for you. So that's working with a smoker who's committed to lifetime smoking, but helping them be as healthy as possible in terms of not having as much consequence to the smoking behavior in terms of impact on their health and well-being. Now, stress management is our next area, and the behavioral targets include relaxation techniques, the physical activity, that's the activity emphasis. Resilience is another one of the issues that can be addressed in a stress management oriented program, and that's where we're looking for things like hardiness, increasing our ability to withstand the challenges and the pressures of our choices in our lives. The health risk we're looking at here is chronic excess stress and also traumatic individual events. So the post-traumatic stress disorder oftentimes comes under this particular area, as well as somatic complaints. And there's a category in terms of the diagnosis that is called somatization disorder. And they're about 25% of our primary care use in the US is related back to our somatization disorder. So these are the people that have a very sensitive disposition and constitution. They experience high levels of stress, and it manifests in a variety of physical symptoms. So those may be sleep disruption. They could in fact be headaches or severe headaches, just a variety of ways in which people express that stress that they're experiencing. Typical interventions in this area include the use of a health risk assessment, asking questions about the stress of the individual is experiencing and any stress management practices they may be involved in. You can do a workshop on stress reduction, stress management. You can have a quiet space so that people, particularly that may be interfacing with the public, either in a call center setting or in a counter setting, to be able to come back out of that stressful situation and have some quiet space to regain their psychological equilibrium. There's resilience education that we can do. Motorola was a wellness program that I worked with that had a full-blown orientation to resilience at the core of its wellness program. So that was what they felt they wanted to use as a primary way to approach wellness with their population. Yoga would be another area of intervention that's addressing stress. We can have issues around time management. So we can put that into some new ways of thinking about how we do this. It might be how unplugging from the current technology. So there's a variety of different creative ways that we can work with how people utilize their time. We can do stretching breaks. We can build those into reminder systems that our computer workers are faced with, but lots of different ways in which we can have people break up the cadence of work activity to disrupt that stress response. Coaching activities, so the ability for our coaches to help us with the stress that we're experiencing and alternatives around the stress reduction, stress management. We can use online LMS modules again, so that can be oriented to that area, as well as YouTube videos in terms of inspiration or in terms of being able to hear a TED Talk on the issue around managing personal stress. So it's being able to put that kind of intervention together around this particular set of prevention targets. The next area is heart health, and we generally are looking at blood pressure screening, cholesterol testing, and medication non-compliance, and particularly around medication dealing with blood pressure control and cholesterol levels, use of statins and so on. So those are the major areas where our behavioral targeting is. And then the health risk that we're looking at is hypertension, pre-hypertension, hypercholesterolemia, pre-hypercholesterolemia in terms of how people are experiencing those drifts in kind of metabolic syndrome, the issue around how sedentary lifestyle comes into play in terms of heart health. Those are the kinds of health risks we're generally focused on in this particular area of prevention target. The typical interventions are going to include a health risk assessment or well-being assessment, using a blood pressure sweep technique where we have the people who can read blood pressure actually going to the employee at their work site and asking about the measurement, and then using any elevated, referring them to a follow-up opportunity to check on the blood pressure if it is in fact elevated. Cholesterol testing using finger stick methodology or venipuncture methodology. So those are different ways of being able to address the various fractions of cholesterol. The blood pressure and cholesterol are part of Know Your Numbers from the national programs run by the National Institutes of Health. Biometric screening and how we capture and put the various biometric screening components together. The blood pressure monitoring. So if we have done a sweep, found someone that's elevated, and that individual wants to monitor and watch what's happening with their blood pressure, they may be under medication and under a physician's supervision, but they also may be doing some lifestyle changes to affect the blood pressure levels. So we have a monitoring and tracking kind of phenomena. That can include, by the way, also some ways of being able to capture information in a personal health record. or using a smartphone app to capture that blood pressure kind of data. And then the issue around medication. So we are obviously looking at blood pressure medications in situations where the lifestyle interventions are not adequate to bring the individual's risk of cardiovascular events and cardiovascular disease down to an acceptable level. And then we also can look at the statins and other medications that are intended to help us with the lipid composition in our serum or blood. The coaching activity would be another one of the typical interventions around this area. Online LMS modules would be another way of helping people with this particular area. Some of our food access issues are likely to affect both the blood pressure and cholesterol levels. So it's the choice of what our eating patterns are, nutrition patterns are. Use of an eHealth portal that may have multiple kinds of offerings to address these underlying behavioral targets and health risk. Weight management is the next area where our behavioral targets include eating habits, nutrition practices, psychosocial dimensions of weight management. So those are oftentimes the areas where we are looking to make some sort of impact in terms of behavior. The health risks that are generally involved have to do with the risk associated with a sedentary or inactive lifestyle, and the category of overweight, and then our obese definitions, which now go up to the level 4 obesity. So those are the issues of the combination of overweight and obesity affecting somewhere around 2/3 of the US working population. And then metabolic syndrome being the way in which we attach and connect the overweight issues with our nutrition practices, some of the underlying issues around our physical activity and or other areas. So the typical interventions we're dealing with are the health risk assessment and or well-being assessment with questions about this area, oftentimes using data which we acquire in our biometric screening to in fact be factored into the processing of our other question responses around the health risk assessment to allow us to then come away with an overall wellness score, an OWS, that helps us understand the overall context of our well-being and wellness. Their use of food diaries to get a better sense of what people are consuming and how their nutrition is potentially affecting their weight. Food access and choice options. So we may have food services that are providing healthier options for people. We may have differential pricing as a way to influence some of the decision making around what foods are purchased. We also have the issue around choice and how foods are presented to people and how that influences their choice. We have organized weight management programs like Weight Watchers that can be done. We also have support groups that can be used in worksite settings as some typical interventions around this particular area of behavior and health risk. We have bariatric surgery options and coverage in our health plan, so that may be a way that we attempt to deal with this, particularly for the category 3 and 4 in terms of obesity. Support groups. The scales in bathrooms, so our ability to use a more medically appropriate bathroom scale to help people with the monitoring of their body weight. We obviously can use BMI and the HRA, so we can report that out as the way in which we cover that. We can use coaching as an intervention to help people with weight management risk, and YouTube videos for both the inspiration, motivation, and some of the skill-based areas of weight management. And then online modules as one of the last elements we might use. So those can be part of an LMS, a learning management system, and our ability to provide that kind of content to people, either on demand or as part of a required coverage in terms of seeing the results of your HRA and then having some either online LMS modules that you need to complete in order to maintain a low level of premium contribution for your health plan. So those are some of the typical interventions that you find around weight management. Nutrition is primarily nutrition practices, food purchasing skills. The health risk involved have to do with fruit and vegetable intake, the 5 a day, 9 a day kind of context for national programs. High fat food avoidance, so that's our fried foods and meat and red meat avoidance. Salt avoidance, water intake levels. Those are some of the major issues that we tend to look at under nutrition. Typical interventions for this area include the health risk assessment. They can include a well-being assessment as well. The food diaries and use of those, cafeteria choices and options, vending machine options, nutritional potlucks, the ability to bring healthy food options into an experiential learning, cooking demos, coaching and coaching activity, eHealth portal, and being able to help people with their nutrition practices. We can also include smartphone apps that allow you to do food diaries as well as assess caloric intake, and online modules that can help us with the educational side of nutrition practices and skills. YouTube videos obviously can do things around food and around food preparation, but also the issues around healthy eating, the issues sometimes of anti-aging strategies that have to do with food as medicine. So there's a variety of different interventions we can use for this particular area. And smartphone apps would be another example of something that would help us related to the consumption of foods. One of the apps, by the way, and services that's provided allows you to use your smartphone to photograph your meal and then have actually a dietitian nutritionist give you advice based on the pictures that you're sending that individual about your dietary consumption. So that would be an example of an intervention that could be used to help people with nutrition. It's got a coaching kind of element to it, but also use of technology to get a better sense of how that person who's got the nutrition skills can interact with you around the nutrition area. The next area is medical self-care, and medical self-care is really a variety of skills. We cover those in more depth in level 3 of the WellCert program, and it basically deals with the skills that are involved in interpreting the symptomatology, the things that are occurring with us individually. And it goes back to that issue around the average American worker has on average about 24 medical symptom events they have to interpret each year. So some people have a higher level, some a lower level, but the average is around 24 per year. So that means that we're actually following a lot and doing a lot related to interpreting those symptoms. And when we use physician-derived or scientifically based help around those symptoms and what do we do with them, we call that general area medical self-care. And medical self-care, we started out using books, medical self-care books in the field in the late 70s, and then held sessions where people were given little vignettes about what symptoms they had or an individual had, and then they had to use the book to find out what to do about the symptom. And after doing 3 of those little vignettes, people's level of comfortability, their confidence in using medical self-care resources was usually elevated significantly. At WebMD, while I was there in 2009, we had some 64 million unique users using the medical self-care symptom checker that is provided free through webmd.com. So that's a medical self-care software package. That's also available, by the way, as a separate smartphone free app now from WebMD. So you can actually have that software app, medical self-care, at no cost, so that you can follow up on the symptoms that you're encountering either in your own health or in other people's health. So the idea of using either the book form The American Institute of Preventive Medicine is a group that still has a number of good medical self-care books that can be used by different types of populations. And then the software application, it would be an example, would be the WebMD example. The health risk involved has to do with symptom ignorance, so not necessarily knowing what is a significant symptom for me to be aware of. The issue around managing chronic diseases more effectively, we call that tertiary prevention, so the ability for us to manage that underlying chronic disease. And then inadequate home care, so the issues around what do we have available to us for medical self-care functions in the home setting. And we may have some diagnostic activities. There's a great deal of diagnostic technology now available to people in your average pharmacy. So you can go to the home diagnostic sections and see what can be used to help you actually make some of those initial assessments yourself and to then treat them according to the advice that a physician would give you. So the ability for you to do that. There's also the issue of patient non-compliance. So we have that phenomena that a lot of medical advice that people get and we pay for through our health plans are not followed up upon by the individual. So we have that whole issue of what's called the compliance problem. And then iatrogenic risk is the issue. The iatrogenic in the Greek means iatro is physician, genic is induced. So it's physician-induced or health system-induced injury or illness. And that's what patient safety is about. That's what the Leapfrog project is about. So it's reducing the risk by being able to encourage people to be aware of some of the risk that they're exposing themselves to when they utilize healthcare services. So the typical interventions can include the HRA. They can ask questions about, do you use a medical self-care book? How many times have you used it in the last 6 months? What's your confidence level or self-agency or efficacy around the use of those? Lots of different types of questions can be asked in the HRA. You can have a primary care practitioner requirement. So you can basically say to people, you need to have a PCP in order to be part of our wellness incentive program or to meet a criteria that is based around PCP and being current on your preventive screening. You can have an educational workshop where people are face-to-face around this area. You can do an e-health portal that helps people with a symptom checker kind of device like the WebMD.com. Advice and method process. You can have a personal health record, so you're keeping in one place all of the medical related and wellness related data on yourself or your family members. You can have the health unit that may be offered in your worksite that would provide some support for this medical self-care if they are tuned to that purpose and that reason. You can have online LMS modules that can be used. You can provide a health advice line or nurse advice line and show people how to use it through demos, increase the use of that significantly by that approach. You can use smartphone apps like the one I mentioned from WebMD that is a free in your phone, your smartphone app store. You can provide YouTube videos that have to do with the skills involved in this particular area. So that would be another way of being able to help increase the medical self-care capability of people in the population you're working with. The last area is a back care area, and the behavioral targets are going to be strength of abdominal muscles. So that's oftentimes a place where our back pain comes from, is if we let our abdominal muscles become very weak, we will tend to put more pressure on our back muscles, and those then begin to start being painful for us. Lifting techniques also have to do with it in terms of straining muscles or causing situations where our discs are affected by the types of demands we put ourselves through physically. You can have back muscle conditioning. So those are things you oftentimes do in a fitness club where you are doing some exercises that are actually strengthening those back muscles. that are helping your body remain in the appropriate posture. You can have relaxation techniques that are used to be able to relax some of those muscles that tend to get painful when they become stretched too far or not capable of taking the kinds of demands we're placing on them. The health risk we're addressing in this particular area is really back pain. So that's a way in which we're focused on that particular risk. And again, about 3/4 of working adults experience within a two-year period some sort of back pain event. Typical interventions with this area can be the HRA, so it can ask about the occurrence of the problem and or some of the risk attached to the behavioral targets. Fitness facility use can be an intervention, particularly if you're helping people bring that particular kind of back muscle conditioning into their workouts and having that be part of what they do when they use the fitness facility, whether it's internal and on-site or external. We can have back care workshops, so we can talk about what are the basic ways of maintaining your back health, your health and healthcare around your back. You can have lifting technique demos. You can have information that's provided on that with stretching and warm-ups. You can do some issues around posture and how our posture affects the strain that we put on our back muscles. You can have stress reduction techniques that are designed to help with muscle relaxation. We can also have medications that have to do with that, by the way, so that we can have a muscle relaxant as part of what we use when we are getting susceptible to this particular problem. And learning management system modules around back care. Ergonomics would be also one of the areas where we want to look at what's the ergonomics of how we have our office set up, our desk, or the place where we're working, or the positioning of tools, the amount of weight that we are extending and lifting and using, just lots of ergonomic related issues around a specific work site. So these again are the typical interventions we oftentimes look at around this particular area of behavioral and health risk issues. And finally, medications. So the issues around how do we use medications appropriately when we do in fact have some of these back pain experiences that we're in the middle of. Now, other possible prevention targets besides the big 8, there are lots of them. So we have lots of opportunities to select targets. These are what we call prevention targets. These are all related to specific types of interventions, and then they are related to specific economic variables. So we can take each one of these and essentially trace how it affects the economics of work and worker health. So these are some of the other possible prevention targets that we can consider depending on the goals of our wellness program and the interests that people have. Now, a summary of key points around this particular module is that prevention targets for wellness programs usually consist of behavioral and health risk issues. So those behavioral risk issues, those clinical risk issues make the opportunities for us to target specific kinds of things. There is a core set of prevention targets that almost all wellness programs should be addressing, and that's what we call the Big 8. A program's goals will help determine the prevention targets that are addressed by the program. So we want to use the goals, and if we can get our senior management to prioritize the goals in our wellness program by using something like a modified Delphi technique, where people are given the goals and then told to vote for maybe the 1, 2, or 3 goals that they feel are most important, we can then collect all of that information and actually create a prioritized list of goals. So that's what can be done as part of a planning process. Some prevention targets produce quicker economic return than others. So if our intention is to produce faster economic return, in specific types of the 5 variables, the areas where economics can be measured around wellness, then we are going to use those kinds of concerns and targets, prevention targets, to get to a faster economic return. By the way, in the Big 8, the last two, medical self-care and back care, tend to be the shorter economic return cycles. So we have some longer lead times, which are the other 6. The last 2 of the 8 tend to be shorter duration. They produce economic return for us more quickly. Behaviors and health risk are interrelated, so we obviously have a mixture of those. So we have some underlying behaviors. Those are frequently involved in a particular activity, that behavior that has a risk attached to it. Each prevention target has a number of alternative interventions. So we have different ways of being able to address specific prevention targets. Prevention targets also have some synergies. So if we talk about physical activity, if we target that physical activity, it's got some impact on our weight management issues, on our stress management issues. It may have an impact on our tobacco use, and it may impact our nutrition activities and or heart health related issues. So there are definite synergies between those. The health risk assessment is an important intervention for most wellness programs. You could tell how often that shows up. It shows up in actually all of the areas that we look at in terms of those 8 prevention targets that we call the Big 8. So the idea that the HRA is one of the ways that we're asking people about their experience and about the specific things that are affecting their health and well-being. The HRA can address virtually all prevention targets. So that's one of the things that makes it important for us to think through how we utilize that data. Not just collect it and say, well, we did the HRA, but if we're not using it to help shape the program and help the individual be motivated for change, then we're not getting all that we can get out of potentially out of that health risk assessment. Prevention targets can be phased in over time, so we need to think about how we kind of move, some out and have new ones come in. We also want to have a core set of prevention targets that we're going to keep track of long term, because they are important in particularly chronic disease prevention. The measurement of the prevalence and severity of prevention targets and needs and risk is to be formed or consistently performed. So we need to be looking at prevalence, and that prevalence has frequency and severity. So we need to be looking and watching what are those targets and how prevalent are they in the population I'm working with. Some prevention targets need to be consistently addressed. So we are going to be looking, that's where we talk about the Big 8. The Big 8 are the ones that we want to be looking at long term. We want to add other ones from the list of potential targets that you saw on one of the slides. But the idea is that the core Big 8 probably need to be consistently measured in our population. All right, key questions. Let's answer, first of all, a question of what should determine which prevention targets your program addresses. Sounds easy. So the idea is that you want to look at what goals you have, particularly prioritize goals, if you can get your management to go through that process of prioritization. And then you also want to be understanding what are the interests of my population in terms of well-being or wellness. So those are going to be 2 of the major things that help me determine which prevention targets I'm likely to need to address. I also need to be oriented toward creating novelty in my program. So novelty is where people say, I wonder what that's about. That looks interesting. So that idea of bringing new targets online so that we can in fact enhance some of that novelty aspect and having people be able to see what it is that they would like to be able to do or to be able to know about. We also have the phenomena of emerging issues, and that's where a new issue comes up. In the past years, we've been looking at the Zika virus, that becomes a concern of people that are traveling, and are they going to be exposed? Are they, are they pregnant? And that kind of issue. In the past, we've had swine flu, we've had avian flu, we've had some concerns for distracted driving. So we basically want to have some emerging issues also help us select those prevention targets in our wellness program. Next question is, which of the typical prevention targets have the most potential to produce economic return related to health plan costs? And if we address the big eight, we've just gone through the big eight, I probably would put the three that I think have the most economic return in the following order. I would say of the eight, medical self-care is one of the highest, fastest returns in terms of economic return. And that's if I can help increase the skill level of people in dealing with their own and their families' medical symptomatology. And then the second area is that in terms of its magnitude is probably going to be the stress related area, and it's particularly around the somatization disorders. So we have a significant portion of the population that is very sensitive to stress. So they experience stress and then they end up with a physical symptom. Sometimes that symptom can be something like, for instance, at the holidays, at the end of the year, having a upper respiratory infection after going through the stress of the holidays. So it's good stress, but it's also stress that causes our immune system function to depress, and we then get exposed to other virus or various types of organisms, and then we come down with an infection of sorts. So that stress-related issue would probably be the second in terms of the economic return, and particularly related to health plan cost. And then the third would likely be the avoidance of back pain. So the back care issues and how we do those. That's how I would rate those three areas of the big eight in terms of their ability to produce economic return in terms of savings in our health plan. Third question is, how often should you change the mix of prevention targets? And I think as a general suggestion that our Pareto rule, the 80-20 rule, is probably a fairly good thing to think about related to changes in the mix of prevention targets, which means that 80% of our targets remain the same. 20% are modified as issues come up that have to do with goals in our program, changes in interest in the population, emerging issues that become of concern, those areas. And that there are a few that are retired. A few of those prevention targets are retired each year, and a few new, a few retired. So we are kind of adding some change to our program, but not a massive amount of change, because we've got 80% of them that are fairly stable. The change is taking place in that 20%. So that's where we may in fact modify the target, maybe tighten it up, maybe look at a particular dimension or part of it. We may drop it out as an issue of concern. We may then add some additional issues along the way. So those are some comments on this whole area of the choice of prevention targets and the matching of interventions to those particular targets. Now you've completed this particular module, go ahead and take the quiz.